Patient and Public Advisory Group was created because there wasn't a clear mechanism for having a conversation with patients right across Kent and Medway. So when the Sustainability and Transformation Plan came into being, this group was created and it pulled together things that were already happening in the east of the county, in the west of the county and in Medway. And it's an opportunity for members of the public to meet with people who represent the public in other organisations, like in the commissioning groups in health and in social care and the voluntary sector. We're really there to help support how the public get involved more widely in the changes that are coming with the Sustainability and Transformation Partnership, as it's now known. So we will talk about what engagement is happening, what consultations are happening, what are the upcoming changes, talk about how the wider public could be involved in that, particularly seldom heard groups, and really just kind of giving help and advice to the programme as a whole and what we think is good practice. I think for a long time these sustainability and transformation plans felt like they were being kind of put together without public involvement. And so I think it's really important that people have a really clear mechanism that they can point to and say, well, there's one place where the public are absolutely involved. So I think it's a really good starting point. We do look at things at a very strategic level, so kind of looking at the whole of Kent and Medway. So it's really important that we also help the programme think about how it talks to people more locally, and particularly people whose voices aren't heard very often. We talk about patients and public, but that means anybody, we're all patients, so it's any member of the public. And we also talk about health and social care services, and people don't always describe themselves as patients if they're in a care home or they're receiving care at home. So it's very much for people who are receiving any of those services. But we're all patients, we all use our GP, we all use the hospital sometimes. So everybody should have a view and have the opportunity to air that view.